Do that. So, in a short amount of time, I thought, I've been thinking about this. This is some of the stuff I'm going to say is really not all that new, probably new to you. You've heard me speak, you haven't been with me. It's a little new to me. I'm trying to put it all together in some way. We'll see if it works. I don't know. We'll find out. That's always an uncertainty. When Harry started out, he was talking about, the kind of context where he comes from through orgonomy and how that reflected his interest and the development of his ideas and his work and the context of that. And similarly, so I want to start out with in that particular vein in terms of where I come, which is a little different than from Harry's point of view. Yes, as you smile. Yes. And there's always been two thrusts of where my work has started out with, because it initially started out in my earliest work in working with children, and my study in counseling psychology, which was in the early 70s, okay, from a very strong humanistic perspective. And that's always been at the core of me. That's something I resonate. And simultaneously, coming from there, coming from Gestalt therapy, okay, coming from finding Reich within those particular roots, I resonated with the work of Reich. And that came from my own actually personal therapy, where I had to confront my own, what then I understood was armor, my own holding, my own emotional restrictions, and so on and so forth. So there was the work of Reich, and reading all of Reich's work, as I was prone to do at that time, and then my own kind of exposure to psychoanalytic work. Kind of thought, okay, where does all of this fit in? How does it all come together? Do they come together? Are they opposed, or are they kind of contiguous or interacting with one another? And one of the things of Reich's work that always took to me, and what I always, was this whole concept that Harry mentioned that we could have a whole day on, was orgonomic functions. And thinking in a functional, energetic way. And I've always, not always, but have put together humanistic work and Reich's work, seeing that functionally they're speaking about the similar aspects. There's many commonalities. And commonalities that if we kind of look at from an energetic perspective, we can kind of see how the language might be the same or maybe a little different, but the impulse, where they're coming from, is the same place. And maybe I came to that because that was the place that I was coming from. If it's coming from the same place, and it seemed to be coming from the same place, then there was a connection there. So what I thought I'd do in a brief amount of time is kind of talk a little bit about some of the humanistic ideas which I see as common to orgonomy, and kind of begin to kind of compare and contrast some of Reich's work with that of humanistic psychology. Particularly, I think I'm going to focus on Roger's work. And the reason why is because that's where I come from. Now, you could say I'm focusing because they both start with the letter R, and that would be that would not be orgonomic functionalism at its finest point. There might be some aspect of that, and it could be because I have a hard time remembering names, but I always seem to remember the first letter of a name, so maybe that has something to do with it. But I'm just going to say that there's something more with that in terms of that. In some way, I think both Rogers and Reich were misunderstood. And in fact, in some ways, in terms of the kind of understanding about the psychotherapeutic technique of Reich and the psychotherapeutic or if you want to say psychotherapeutic technique of Reich, you wouldn't really say it in that particular way, but the therapeutic technique of Reich or the therapeutic technique of Rogers, there was always a misunderstanding about that in terms of really understanding the depth of it. And also because I think Rogers in his earliest work, and then as it gradually became to develop, I think articulated very well some of the processes that I think are inherent in therapy in general and which we can see happening in orgone therapy. The approach might be somewhat different, is somewhat different. And I think that's another aspect that I've tried to kind of bring together in terms of the aspect of more traditional orgonomic work and simultaneously then, or along with that, the work of Rogers and humanistic psychology. So let me just run some ideas by in terms of this, and maybe as you sit with this, as you listen to it, you can yourself kind of say afterwards, that fits, or that doesn't fit, or here's the contradiction, or where it is. So one of the things that really grabbed me very early on, and this is something, if you work with children, I believe it's there. You know, you've got to be blind not to see it, though most of us are blind. So, okay, it's there. Is that the tendency, the movement toward growth, towards development, actualization, towards growth, development, actualization. It's right there. Okay, it doesn't have to be taught. It doesn't have to be instilled from the outside. It is inherent. You watch a child, you see it. So, when humanistic psychologists or say that humans are inherently active, curious, purposeful, directional, it's right there. Mm-hmm. When they speak about humans, and Reich would say life, okay, are expanding their capabilities, actively attempting to change their world according to their needs, okay, that's right. Of course, if they're labeled as selfish, as manipulative, then already that changes. But that movement is so apparent there. If, as Rogers says, humans have, quote, one basic tendency in striving to actualize and maintain and enhance the experiencing organism, which is the word he uses, yes. I look outside my window and I see this boy that I've been watching develop over the past few years. As he's growing now, he's 9 years old. And see him continuously, day and day, outside at that basketball hoop. And how he's developing his skills. And first it's so chaotic, and then it develops more and more, becomes firmer in itself and his skill level. But the drive there, which is of course supported by his father, who in a very wonderful way does not teach him this, but engages him with it. There it is, that movement, that energy to develop, to actualize themselves. Now, an author said that this actualizing tendency may be thought of as a directional energy subsystem, organized to promote life-preserving, developmental, and self-enhancing processes. It's literally an energetic phenomenon. Something Rogers, though did not emphasize, clearly was speaking of. Now, the other aspect, though, is this. If these tendencies are not blocked or distorted, then one begins to feel truly free and responsible. Kind of going back to the conversation we had a little bit about responsibility, about the difficulty of retaining responsibility. If these tendencies toward movement, towards actualization, the word that Reich will use is contact and engagement, is not blocked, then there is that sense of freedom. And then there is that taking of responsibility. Free, in a sense, that this is the person's nature. And striving comes from an inherent tendency to maintain, express, and actualize their own experience of being. So you see, I see, or maybe I imagine into, you can judge, in this boy across the street, this sense of both freedom but responsibility. The sense of the freedom in his movements, but the responsibility in engaging in that. Now, the humanistic idea is that this is growth. However, growth is always embedded in an environment. And for growth to occur, basic supporting conditions and nutrients are needed. This has always been something that has struck me. I think, we can come back to what we talked about last year in terms of attachment theory. Okay? What we were talking about essentially is the basic nutrients. When we talk about contact and elements of contact, we're really talking about the basic nutrients that are necessary within the environment to actualize this growth. And, of course, the inverse is without that, the plant really can't come to fruition. Another factor, or another part of humanistic psychology, or Roger speaks of, is that the organism is always in motion. There's always a stream of felt processes embodying or leading to symbolic ideation. And this is the term experience, that there's always a sense of motion, movement. You were mentioning earlier, coming from Engels and Queerly Reich, the emphasis on motion, and the emphasis on the inverse of motion, which is rigidity. And where rigidity then leads to, and is part of, inability to take responsibility, leading to fundamentalism, whatever manifestation. Okay. But the emphasis on motion. And without that motion, Reich would say, there's no emotion. Rogers would not put it exactly like that way. But there's no sense of embodiment, no sense of felt experience, which is how we know ourselves. So, I have a quote here. The central idea of process conception was that a significant change in therapy was not a movement from one kind of fixed but faulty structure to another kind of set but adequate structure. Okay, we're now talking about therapy. Not a change from one constantly repeating pattern to a different pattern, not one set of cognitive ideation to another cognitive ideation, you might say. Rather, the essential direction was from a relatively fixed, closed, self-perpetuating quality. Fixed, closed, self-perpetuating quality to an open, flowing, self-transcending quality. From fixity and recycling motion to a formative changingness, briefly from a condition of stasis to one of process. You hear in there many words that can remind you of Reich. I mean, even stasis. Stasis is a big aspect in Reich's idea, though Reich would define stasis in much more bioenergetic terms, but the idea of stasis to process. Now that's a quote from Barent Leonard, who's actually, I took some of this outline from his book, Client-Centered Therapy, on Client-Centered Therapy, and on Rogers' book. So, we move from rigidity to fluidity. That's central in humanistic psychology, central. Now, So, I'm going to talk a little bit more about how then Rogers conceptualized the development of self, which we might actually look at, in a Reichian point of view, or Reich's point of view, as a development of character. Because we have fluidity, and then we have rigidity, okay? And then we have the development. That boy, how is he developing this sense of self? And what does that actually mean, a sense of self? So for Rogers, okay, self happens through the experience, through interaction with the environment. And particularly, he points out the environment of significant others, and becomes crystallized into the concept of self. And one of the things that Rogers from early on, which is a little different from Reich, is that Rogers often is talking about a conception of self. Though some of the later non-directive therapists, are kind of moving from conception to embodiment, which is a little closer to Reich's idea. But Rogers is more initially in terms of conception of self, a self-identity. But it happens through the interaction, always through the interaction with significant others. And Rogers goes on, there's a pervasive and potent need for positive regard from others. This is a need we have, positive regard. However, we sometimes think of, we just want positive regard. We need to be looked at in that particular way. However, he points out that positive regard can override an organismic valuing process and prevent the full expression of an actualizing tendency. This is something at times we don't really kind of realize, is that, now why is that? It's because as the individual in the face of the other develops their own sense of self-regard, their own sense of identity, okay, behaviors that others approve of are incorporated in that identity, and behaviors, attitudes, feelings that the other doesn't approve of becomes not incorporated, isolated off. And if some of those behaviors, attitudes, feelings are isolated off, are not approved of, even though they're part of one's organismic expression, they cease to be part of the concept of self. They become set aside. And that in itself can disrupt one's contact and one's natural organismic valuing system. So, Rogers in here is really emphasizing a few things that I think we and Reich would talk about, though in a little particularly different way. One is really how the importance of really the connection with meeting, the meeting of the other. Okay? Reich, very early on, as I see it, as I understand it, took therapy out of an intrapersonal to an interpersonal place. And he emphasized meeting, engagement. Okay? And he emphasized, as we'll see, the idea that the natural process was for making contact and meeting of the other. In fact, Reich writes in character analysis, though this is pretty early on, the first striving of any living organism will be the striving for contact with the outer world. So in a sense, he's saying something very similar, though, as Reich is often to do, he's speaking of any organism, right? Not just the human, but any organism is for contact with the outer world. In that contact, there is meeting. And this meeting is what forms then how the organism then begins to structure themselves. So there's the meeting, and there's the reaction of others, which is important, right? Would always speak about how is that responded to? How is that interaction, that contact responded to by the outside world? And there is the process in what Rogers is saying in terms of introjection. Like what happens when the outside world says, this is good and this is not good. How that becomes internalized, and then how that forms your own character structure. So, for Reich, this meeting, this connection, as you well know, I don't even have to say it, but I'll say it because what else do I have to do right now? What this meeting and connection is all part of this process of pulsation, right? It's all part of this process of moving out into the world energetically, is self-actualizing, coming to the world, making contact, and then withdrawing and coming back and going back and forth. And that is the process of life. And Reich would even further say that this process of life is a bioenergetic process, which is something that is not really spoken about in Rogers. Rogers, and as I quoted saying, there's an energy there, but Reich is far more specific about it. It's not just an energy, it's how does energy work? It's a process of charge, contact, discharge, relaxation, back and forth. And in the process of that, the formation of a personality, or in Rogers' term, a self, takes place. And as I say, right, it's based upon the response of the environment to bids for contact and emotional expressions. How does the environment react to that? But Rogers says, and I think Rogers is correct, and I think that goes with attachment, by the environment, primarily, we are talking about significant others. Though, of course, significant others broaden as the child grows, as we grow. You know, there's a broadening, just like there's a broadening of attachment figures, right? There's a broadening that happens. And how the world responds to that is going to then organize by developing personality, or, in Rogers' term, self and self-worth. Now, Rogers goes on and says, in a sense, that as certain behaviors or inner states are not recognized as self-experiences, are not owned by the individual, or in their picture of themselves, okay, then there becomes an incongruence between self and experience. Right? Our identity is no longer congruent with our experience. Okay? And this leads to what he calls a state of vulnerability. And I think by vulnerability, this is what Reich would almost kind of say as almost like a structural vulnerability. A person is vulnerable because they're not integrated. One of the things in orgonomy, one of the important aspects is that, and I think this was just touched upon at the end of the last conversation here, is that how do we address some of these things? Okay? And essentially, we have to start from the beginning, rebuilding structure. Okay? We can't, once you start tearing down old structure, you're going to get the secondary layer. Okay? We've got to go and build up structure. And that's what happens in therapy. Okay? From Rogers' point of view is that what happens is you have this vulnerability because isolated parts of the self are taken away. And so you have some parts of the self that are accepted and felt, other parts that are not. And the inadmissible parts of the self that is not self, that is no longer this self, you know, it's almost like it's put to the background, as Rogers would say. It's kind of, it doesn't seem to really be part of the self. But there is a sub-seed threat, there's a vulnerability, which he would say leads to defensive reactions. He would say psychological defensive reactions, and of course, from orgonomic terms, it's a whole biophysical defensive reactions. Okay. The defense allows an individual to maintain an acceptable self-concept, but there are costs to remaining and maintaining this self-concept because of this aspect of vulnerability. And this leads to, as they speak of, a tightness and rigidity of perception, a potential for intense arousal or overreactivity, and the effect is to minimize conscious inner conflict and anxiety. So, this is very similar, if you think about it, to Reich's idea. Well, what is it similar to? Similar to the idea of armor, right? What does armor do? Armor is a rigid stance. Of course, Wright says it's not only a conceptually rigid stance, it's not only a conceptual ideation, but it's a rigid stance in the whole biophysical structure. Okay. It serves as a defense from painful emotions, painful feelings, or feelings that, from a Rogerian point of view, are painful in response to the fact that they are not accepted. It serves as a defense. And simultaneously, it serves to bind anxiety. Right? Because there is anxiety based upon the fact that these impulses are not being accepted, and anxiety because the structure itself is not that solid. So, armor emerges, and armor for Wright is the reaction to attempts to make contact, and when those attempts are thwarted. Okay. And thwarted in Wright's idea by two ways. One by either indifference, absence, and the other by attack. Okay. By the lack or the attack. Okay. In both of those, you could see from a Rogerian perspective, those might be some of the two ways in which the outside significant other either accepts or doesn't accept. Right? Either accepts an impulse or doesn't accept an impulse. And those that are not accepted, how do they not accept it? How does the individual, the significant other, not accept it? Either by ignoring it, it doesn't exist, which would then lead to probably shame, right? Which would then lead to retraction, okay? Or directly attacking it, okay? Which would lead to possibly shame, possibly fear, okay? And again, just retraction. And these aspects then become pulled apart. Now, as Wright so often says, this has to happen in a repeated period of time, but gradually the organism or the individual becomes accustomed to that state, and what do? They begin to armor against that. And they begin to isolate those aspects of themselves that give rise to anxiety and shame. And Wright has a term for that. Later on in his work, he has a term for that. He speaks about as sequestration. Right? That's we were recently speaking about that as we were going through selected writings. And toward the latter part of his work, right, this is after the Orgonomy experiment, when he was looking at what atmospheric conditions and what was happening to the energy, he really noticed that energy that became kind of violent and disturbed in whatever way had to be walled off. And that walling off he calls a sequestration. And he said that happens by as well. That those areas of distress become walled off, become made in a psychological terms as not me versus me. In biophysical terms, they become walled off as armor. Okay? And they become, in a bioenergetic term, doorish. Okay? They become deadened. They become immobilized parts of themselves, of ourselves. And as Wright further later on speaks about, in that doorishness, that sense of it not being alive, then we further wall it off. Okay? We further wall it off because it doesn't feel good to ourselves. So essentially what happens is in the process of developing this character, which is character, muscular, biophysical armor, that becomes for Wright the total biophysical mechanism via which, from a humanistic perspective, at least from a Rogerian perspective, we see aspects of self or aspects not being identified with in terms of your own identity of self. And it becomes walled off, put away, and it becomes not self. And the goal of therapy becomes to bring those parts in. Reintegrate that. Because essentially what happens from a Wright's perspective, and also in a similar way from a Rogerian or humanistic perspective, as that happens, as you bind energy, you lead to not being able to make full contact. in Reich's term, you prevent full orgastic discharge, which happens in full contact. You prevent that process of charge and discharge, and you lead to essentially a person that is more isolated and disconnected from the world, because they're living with a certain kind of identity, and they can't fully actualize themselves. So, in a sense, then, this whole process of becoming more actualized, becoming more connected, is what both Reich was moving towards, and which humanistic psychologists are moving towards. Yes?
As far as the walling off is concerned, how do you see that manifesting in disease?
What kind of disease?
That's what I mean. Like, do you see that manifesting in a certain type of disease more often than others, or depending upon where the walling off is occurring?
In all disease.
Yeah.
In all kind of disease, which interestingly is called disease, and it's dis-ease.
Right.
Okay. In dis-ease, we have a walling off. We have essentially what often happens, just like if there's a pain or something like that. What happens is we tend to contract around the pain, right? And then we wall off from the pain. And then we isolate from the pain, and then we compensate around the pain, and then it becomes a not I in some regard, in a physical sense. In an emotional sense, it is like this aspect of myself, these emotions are not my emotions. They're no longer me. We either contract against it and not there, or we project it, or we do something in the world to get the other to activate us in a way that we have to run away from it. But I think in all disease processes, and that was his idea of the biopathy. What happens in the biopathy is there's armor in some aspect. That creates a kind of an energetic contraction, and then that prevents then the pulsation from occurring, and that becomes then more deadened and more unalive, and we keep that process going. So in a sense, then it happens there. Harry, you have a thought?
Yeah, no. I mean, in response to this, I think this is the first effective presentation of Rogers in context of this. It's been fascinating. I mean, I haven't considered Rogers for a long time, but it's very convincing. But I think the problem here is Rogers, as I understand Rogers and the Rogerians, would have a hard time answering that question, because they tend to not really address issues of disease per se. I don't know the full range of recent Rogers himself, but the issue, as Dan is addressing it bioenergetically in terms of Reich, is correct. It's as the organism becomes chronically depleted. What Reich finally said really is it becomes increasingly a process of shrinking. You have what he calls the final construction of this is what we call the shrinking biopathy, which is that the organism begins to literally, in places as well, or totally begin to shrink away, in a sense pulls away from not only pulsation, but eventually pulls away from life, and then as a result cannot metabolize enough active energy, literally, so it begins to become depleted and deteriorate. It's very fascinating to hear how Rogers would address, because in my knowledge, Rogers doesn't usually get into addressing issues of disease function in a biological sense.
No, I don't think so. I think though, if you look at some of the client-centered therapists after Rogers, and especially, I'm blocking on his name, but who's the person who did focusing?
Eugene Genlin.
Okay, Eugene Genlin, who's essentially considered an extension of Rogers' work. Genlin kind of moved the whole non-directive process and the idea of self into a much more biophysical kind of way, of kind of looking and using much more biophysical terminology. And
yet, I was involved in the focusing community at one point. One of the reasons I left it is then it became what I defined as acceptable felt senses.
Right.
So there were certain felt senses like rage, or in other areas, or like on a lot of other areas, but that then it wasn't acceptable.
Right.
And then we're right back into your work this morning.
Exactly.
Yeah.
Exactly.
So back to Matt, your question, if you want to go real basic, and that's the best basic way to look at it as a shrinking, then you think, okay, well, there's an asymmetrical aspect to that. Every organism a little different, kind of gathering. And so where the shrinking is going to emerge and manifest as a symptom, it just depends. It's going to be immune system, it's going to be, some kind of cerebral function or a joint issue or, a digestion issue. That's where it becomes infinitely complex.
It would also have to do with the capacity. Each individual organism has an inherent capacity. Some organisms are much from birth are much more. It's not a question of better or worse, but some organisms have a different capacity and pulsate differently. The pulsation is not all. It's not automatic. Reich is very constantly looking also at one-celled organisms. If you look at look enough under the microscope, you see that even among amoebas, you can watch different amoebas, that function, differently, even in the same environment in terms of their ability to pulsate and to ingest, in a sense, energetically. So I think there's some. It's not. The danger would be to get into it as predetermined. It's not. I don't think that's really the right way to look at it. But there are different capacities, and not every organism pulsates. It's not a group of. We're all pulsating. This one has a problem and stops pulsating.
Right. Oh yes.
One real quick thing. Affective neuroscience talks about this exact same process that they're talking about, and uses even some of the same terms, which I'm very excited about, but where they end up talking about is the stress response, and all of the things that are linked to the stress response. So that's where I would go.
Yeah, right, exactly.
Yeah.
Right. Okay, I'm aware of our time, and I just want to kind of, obviously, I'm excited that more things can emerge from this, that we're just kind of touching on it. Obviously, I can touch on it a little more. But I just want to kind of go to the whole title of this, authenticity. Okay, and I just want to read you a quote from Rogers, which I think, again, kind of speaks to some of the commonalities. And I also think speaks to, and one of the things we clearly are not getting into is, how does that influence you as a therapist? And what happens therapeutically? Because I think, and I'll extend this, over time, is that many of the issues that Rogers and humanistic psychologies address in terms of the process of therapy are things that needed, and in my work and Mitch's work, and maybe to some degree in your work, we can all kind of say, really enrich the therapeutic experience in kind of ways that in traditional orgonomy didn't really know that much about, just because of the way the conceptualization was, and also because, in a sense, some of orgonomic work came from psychoanalysis. In a similar sense, Rogers, because the humanistic psychology was a counterforce. It was called, it was one of the counter forces, but though American-based, against some of the ideas of psychoanalysis.
Yes.
In a similar sense, Reich's work was a counterforce against some of the ideas in psychoanalysis, which is why at one point the bulb went off in Reich's mind and says, I'm not doing psychoanalysis anymore. No longer is my work within the field of psychoanalysis, though I wasn't keeping it within that. And in a similar way, I think in some way that was coming from a similar source. From Reich, of course, there were many different aspects, but the whole idea of the death instinct, the whole idea of really where the unconscious is versus a creative core, an impulsive core that is good, that is positive, that is actualizing, versus a negative kind of more repressive need for repression and the death instinct and all of that. Essentially, some of the early psychoanalytic work comes from and is part of that kind of idea, which then led to how does a therapist and client interact? And Reich, as Reich moved away from that, it's kind of embodying much more of a humanistic kind of perspective. But I think Rogers and those who followed and clearly within some of the Gestalt kind of ideas, have taken up on that and really have looked at really what is the basis, what are the kinds of interactions that are really necessary that in Reich's perspective would be assumed under creating good content. Right. So that's a whole other discussion in itself. But I just want to read this aspect in terms of authenticity, this quote by Rogers. And this is 1966 from his book, Client-Centered Therapy. Genuineness in therapy, because we didn't really talk about that, but genuineness is really one of the important core conditions. I'm being real, okay? I'm being genuine. I'm not just putting on a role, okay? I'm being genuine, okay? Genuineness in therapy means that the therapist is his actual self during his encounter with his client, without facade. He openly has the feelings and attitudes that are flowing in him at the moment. This involves self-awareness, contact with self. That is, the therapist's feelings are available to him in his awareness, and he is able to live them, to experience them in the relationship, and to communicate them if they persist. The therapist encounters his client directly, again, the idea of contact, okay, meeting him person to person. He is being himself, not denying himself. You can kind of go back and say that the whole kind of issue in terms of the initial encounter and the actualization there. It is not simple to achieve such reality, as Rogers knows, as all of us know, right? In all aspects of our life. Being real involves the difficult task of being acquainted with the flow of experiencing going on within oneself. Flow of energy, right? A flow marked especially by complexity and continuous change. I like that. Oh, and I like that too. Yeah. So, central to his understanding in the process of therapy is a perpetual striving and congruence and experiencing the organism, and there's aliveness and movement, and that is so central to both authentic living, being authentic in self, connection, and the process of being alive and moving in the continuousness of change. And I think, to me, that is what is central in orgonomic work. I mean, what are we doing with clients? What are we doing? We're fostering movement. We're fostering taking rigidity and helping a person move from rigidity to movement. Going past that sense, as you were talking earlier, about the fear of movement, the fear of self, the fear of the emotions that are going to come up, okay? The fear of that aliveness. Kind of moving from this kind of structures that prevent us from being alive to those that allow it. But I think as Wright points out, and maybe this is undermined in humanistic work, is that there's a real terror to that. That was the other thing, kind of coming full circle, that as I kind of held both of these ideas, as I held in myself these humanistic ideas, and Wright, one of the things that struck me, and always seemed true, is that Reich in some way captured how difficult that is. You know, the reality of the difficulty. That one can get almost seduced in a way by, yes, we want to actualize ourselves, and if we just have the right conditions, that will emerge. But I think Reich was closer to the fact, over many hundreds of years of conditioning, that our character structures don't open up that easily. Okay? And that underlying that, we really do have a terror. We do have a real terror of living. And so that becomes the point and counterpoint. That becomes for me the both hope of humanistic psychology, but almost a reality grounding of Reich, but without a pessimism. That's my talk.
Well,
But go.
But just in terms of the idea of genuineness, I'm
Yeah.
just thinking of some clients, of myself being really aware of there are certain things I'm feeling in response that I can't show to them yet.
Yeah.
And so just
But that is
and
so
that's also
but that's
in
perfect.
contact too.
It's totally.
Yeah.
If you're aware of it,
Yeah.
then it's genuine. Then you're being
Yeah.
genuine. Genuine doesn't mean necessarily that's the danger of as in a relationship. Especially with young people, even old people. It's like I feel this. I got to tell you,
Right.
and
Yeah.
that's
Just
really
tell
I
me
got
the truth.
to really be true.
Yeah.
And sometimes I'll say to a patient, "That was the stupidest thing you could have done."
And that's a very genuine response.
I was trained by someone who didn't mince any words, and Wright evidently tended to have that quality.
So it's just a need to discharge an energy, essentially.
Yes.
It's really an act of anxiety. It was like in my first marriage when I was very young. If we were going to bed at night, my wife would sigh. I'd say, "What's wrong?" And if I pushed long enough, we'd find something. And it would lead to nothing. It would lead to just a mess. That's neurosis. But so you're being genuine doesn't mean saying, "Okay, I really think you're feeling." You have to. I feel this way about what you're saying. Mm-hmm. That's not necessarily genuine. Mm-hmm. It might mean that you have to wait a year before you even encounter that and say it. But genuinely where you're at with that, mm-hmm. or at least where you're starting with that. And that's very active. I mean, I've seen. I remember we had to watch films of Rogers working. Rogers would be very, very present, very genuine. You would see him, but he wouldn't necessarily say everything. And later, when he was interviewed about what he was feeling, he said, "Well, I was feeling this, but I had to say this because that was where it was, where it was." And I think exactly. I think what Reich is interesting is Reich makes very specific points, in particularly character analysis and in function of the orgasm, of his decision, for instance, what a monumental decision this was, considering to move from behind the chair to onto the side of the patient and to have facial direct contact with physical contact with the patient. And he says in character analysis, if you read it here, is that once you do that, it requires that you be in constant contact and observing as actively as possible. One of the reasons that everyone was behind the chair was because Freud could not tolerate looking at people directly. I mean, this is known from Freud's own writings. This is not speculation. So he was really part of the problem inherent in psychoanalysis was Freud's own and the discomfort of many of being in direct contact. Reich was radical and was saying this is not going to work unless we get real, and that means you got to see me too. And there are descriptions of people who work with Reich, even though he said he didn't like people writing down descriptions of what he did, what happened, of saying that they would get really angry at Reich at times and really go when he would push them, they go after him, and they expected to see him sitting there going, and he would be sitting there going, like really, he was being like, it wasn't easy, and so that's being genuine and that's being present.
Mm-hmm. Mm-hmm. Thank you.
Thinking about Rogers, like the quality of Rogers listening,
Yes.
and like the listening and reflecting what isn't said, but it's what's almost said.
Yes.
And it's the same with Reich in terms of highlighting an impulse or bringing light to it, awareness to an impulse as it emerges, like as it's on the edge of consciousness, and how similar that being genuine is for both of them.
Yes.
It's like what's right on the edge of knownness.
Yes. Exactly. Exactly. Yeah.
So you're
And you can't really do that mechanically. I mean, one of the things that, early on with, the jokes about Rogers or non-directed listening or even the training of it would be almost like you're parroting what the other is saying, but not capturing exactly what you're saying. That you're really listening. The kind of way that you're listening is you're just listening to that movement and really what isn't there, what is just in the background, but you're observing and hearing.
Right.
And in a way, Rogers was to therapy in terms of listening to the inner states through language and imagery that Reich was to therapy by listening and observing the body. Because in a sense, Reich was so observant in this world, the of the visually and in the concrete feeling of that he could feel into what was next and observe that. That was the expressive language of the living. But for him, the expressive language of the living was a nonverbal expressive language. For Rogers, the expressive language of the living, though he didn't use that word, but I'm going to add to it, was the verbal, internal imagery. And I think they're both ways of contacting that sense of movement, of what's there and what's next. And of course, it's bringing those two together. Not only bringing and hearing the affective tone, which you need to hear, and the facial expression, and the change in respiration, and the different in pulse, and the different in feeling, but hearing the implicit underlying meanings that to me are really other aspects of energetic pulsation. It's just another way that pulsation gets translated.
Baker,
one organ.
Baker, in his book Man the Trap, I was shocked, makes a comment to that. He was talking about the working the person, the breath, and working somatically, pressing on the areas that are holding. And he ends a little paragraph. I sometimes wondered, and I don't remember the quote exactly, that if we were perceptive about that was what is about next to happen, that a lot of the work wouldn't need to be done. That's what he says. I've always wondered about this.
Right.
Something
A
like
lot
Man
of
the Trap.
that, yes. Yeah. I think that's an interesting, I remember that as you're saying, that's very
huge.
perceptive,
Yeah.
yes.
It's probably the most important line in that whole book, I guess. Dan,
Yes.
when we see examples of you, like we do in our trainings, working with clients, a lot of what seems to get them back closer to their emotions is the way that you're reflecting with them. Is that, and I don't have a lot of knowledge about Rogers, is that a lot of Rogerian stuff?
It's a poor man's Rogerian.
Okay.
Yeah.
Pig Roger.
It's pig right, yeah. It is an active attempt, but it falls short, I think.
So that's what. So
Yes.
that would be
Yes.
the mirroring and with the face, with the body,
Yeah,
with the
the mirroring,
breathing.
right, and yes,
Tone.
and yes, and yes.
But I would say that if you're working orgonomically and really in touch with the patient, a lot of that would emerge fairly spontaneously
Well,
if
yeah.
you're really in contact.
But you don't. But when you see videos of orgonomists practicing, like American College of Orgonomy.
But that's
Just to finish my sentence.
I'm going to be very.
Just to finish the sentence.
Okay.
You don't usually see that. You see a distance, which feels very.
You wouldn't.
It's like
You wouldn't
right
see
away.
it because they don't do what I call orgonomy.
Yeah.
And they don't work the way Reich. I mean, the few instances we know of Reich where Reich worked, he was extremely active,
Yeah.
extremely spontaneous. One of the most common things you hear, there's a couple film, and one of the things he most commonly will say to patients is he'll be facing him and say, people who describe, I have a patient actually, I'm going to talk about that, who was seen by Reich, and she said what he did is he basically sat down next to her, looked at her. He said his eyes were continuously in contact with her. He only worked with her for about 15. Reich also just didn't work that long. Well, he sometimes would work only 10, 15 minutes on a patient.
This was like for an evaluation.
No, even in treatment, there was time. He didn't have a 45-minute hour or a 50-minute hour.
So he was very.
It was what he wanted to get done. Was what
But
he
the
got
contact,
done.
you're saying he
the
was.
contact was very intense. It was not intense. It was just very constant, and it was very soft.
Okay.
He was very available. His most common expression was, "Come through, come through, come through." Not breakthrough, but come through.
Invitation.
Yeah, and often she says she's an interesting case because she was very in contact. She said she felt that he was authentically asked, that it was real. It wasn't a trick. And the other thing was that he was extremely encouraging, so that when people who could do very little did something, moved a little bit, he was extremely enthusiastic and extremely encouraging of that little bit of movement, rather than where we're going to get, why can't we get further? You know, and where he would be less encouraging is that if it was a patient he felt he couldn't work with, he couldn't get any place with, he had a tendency to just say, well, I'll refer you to someone else. You know, I don't have the time or patience to. He wouldn't say it directly to them. He would just make that note.
I got to get back to the lab.
You know, or I just, you know, I'm not going to help. I'm not going to be able to help you because I'm not. That was another very honest thing. I think that relates to this too, of being able to say, you know, I don't think I'm going to be able to help you. I don't think the contact. I mean, I think there's a tendency among therapists when you become a therapist, not just professionally because you want to keep patients, but there's a tendency to feel that, well, you should be able to take on any patient and help them and do your work. Instead of being able to say, you know, sometimes you get to a patient and say, you know what, I can't imagine working with this person for the next 6 weeks or 6 months or a year or so, because there's just no, it's not a right fit. And to have that honesty, that ability to say, you know, maybe you should see someone else. You know.
Yeah. Well, we can talk more about that. That's an interesting thing because, you know, I think, you know, I think those things can change.
Yeah.
Can kind of change over time as you know, get to know, as you work with people. You know, sometimes the initial, at least in my experience, the initial.
Well, I didn't mean so much initially.
Yeah. Yes. But over time, maybe you find that you can't overcome what it is that is the block
or the
between
reverse,
or you know, the lack. Right. Yeah, both within and between. Okay. So what do you think? Does it make sense?
Yeah.
I mean, you're going to support my thesis here?
Well, I don't know enough. But it's great to be able to see these other, you know, just like you've done with attachment in terms and affect. It's great to, because you just, once you know this through doing the therapy or doing the, you know, from a training or practice perspective, you can't help but have this energetic pulsation become the core of the way you view things. So it's really valuable to then to see how that can work into these other ones.
Yeah. Or in other ways, how it is already in.
Yeah. Okay. Yeah. Why they're working?
Yes.
Right. Some of these separations into different disciplines and these sort of lines, I think that's what's very interesting about this. I mean, I never would have thought of putting Rogers and Reich together and everything. It's like, but I think these separations in terms of discipline, it really damages a lot of, you know, the whole process. You know, Reich was famous for saying, if it doesn't matter, use any of it. Use all of it as long as it gets energy moving, as long as it brings you through. And so I've always thought one of the things Reich always did was always consistent. One of the reasons I was always interested in attachment work was the idea Reich was always saying you have to encourage the patient, you have to make them really feel that